Good afternoon, everyone. First of all, I welcome our President, Dr. P. Senguttuvan sir, for this Organ Donation Committee CME. I welcome Dr. K. M. Abul Hassan, the immediate past President, sir, and Dr. B. Sridhar, the State President elected 2025. I welcome Dr. S. Karthik Prabhu, sir, the Honorary State Secretary, Dr. S. Gauri Sankar, the Honorary Finance Secretary, for this meeting. I welcome our the convener for the Blood and Organ Donation Committee, Dr. S. Sukumar sir. Today we are starting our Organ Donation Committee CME for this year 2025, and I welcome you all. This is the Organ Donation Committee which we have taken over, the advisor being Dr. S. Sukumar sir, and myself as the chairman, Dr. Rajesh Babu, and then the conveners are Dr. G.N. Suguna and co-convener Dr. R.K. Rashmi. And the members are Dr. N. Soundarajan from Vilupuram, Dr. Bommusamy from Avinasi, Dr. K.B. Sivaprakasan from Mathur, Dr. Vijayanand Palnisamy from Salem, Dr. R. Ravindran from Madurai, Dr. V. Jayaraj from Madurai, Dr. T. Kanagachala Kumar from Erode, Dr. G. Murugan from Dharmaburi, Dr. P. V. Ramesh from Kallakurichi, Dr. T. Nailesh from Vellore, and Dr. Rajesh Sengodan from Salem. These are all our members, and it is a team of about 15 people. We are going to do the active Blood and Organ Donation Committee activity. Today I had the opportunity of discussing with our the TRANSTAN, the secretary, Dr. Gopalakrishnan sir. He was very much thankful to our IMA, telling that the Tamil Nadu records the highest number of deceased donations in 2024. The number of donors were 268, and in government hospital 146, and in private hospital 122. Major organ 863, minor organ 673. Total number of organs utilized 1,500. And the cause of brain death RTA 186, non-RTA 82. And this was the graph which is showing, see, from 2008 onwards, which our Tamil Nadu, and is going up and coming down, and now it is going up very high, and which was showing all the organs: kidney, liver, heart, lung, pancreas, small bowel, cornea, bone, skin, heart valve, one hand, all the things. He was very much appreciating of our IMA activity, and we will coordinate with him, and we will try to get more of this help from the TRANSTAN also. This is for your information. I welcome you all for this Organ Donation Committee meeting. And now I invite our President, Dr. Senguttuvan sir, to give his presidential address and inaugurate the session.
Thank you, Rajesh, for your nice introduction and a detailed report of the Blood and Organ Donation meeting. A very established record was created by you. Respected past President Dr. Abul Hassan, Blood Organ Donation Committee Chair Advisor Dr. Sukumar, Honorary Secretary Karthik Prabhu, Organ Donation Committee Chairman Dr. Rajesh Babu, conveners Dr. Suguna and Dr. Rashmi, and other delegates who are attending this Blood and Organ Donation meeting. Likewise, the blood and organ the traffic awareness, we are creating more road tracks accident, and in Tamil Nadu is the second place in accident throughout India. So to reduce the accident, we have increased the awareness program, but at the same time, Blood and Organ Donation Committee is concentrating on the donation of the organ donations and body donations. Last year, our member Dr. K.P. Sivaprakasan has advised our member, and they donated their body, and he received the awards for the same. Likewise, all the members should concentrate on their meeting and emphasize the importance of the organ donations. So everything is possible, and due course, these are the main projects coming to the medical field. So with these few words, I thank for the opportunity given by the medical advisor, organ donation advisor Sukumar, and so Rajesh Babu and others. Over to Rajesh Babu. Thank you.
Thank you, President sir, for your nice words, sir. We will follow your instructions, sir. Now I invite Dr. K.M. Abul Hassan, the immediate past president, sir, to give his felicitations.
Good afternoon, all. Thank you, Rajesh. Respected President, Dr. Singhutan, Dr. Sukumar, Speaker of the Day, and all the office bearers of IMA TNSB and my dear attendees. Organ Donation Committee is one of the important and very crucial committee formed in IMA Tamil Nadu State branch. Last year also under the leadership of Dr. Rajesh Babu and the team performed very well. They had meetings every month without a miss and covering all the subjects. And only one message I would like to give today is, organ donation and organ. So we have to champion the cause. Now many doctors are coming forward to pledge their organs and also giving lots of, giving blood donation at the time of need. Maybe I want to share with you a small piece of a story that 4 decades ago, I started a blood donation scheme in my college when I was doing my MBBS. That time, even non-medical people were very much coming forward, enthused to give blood. But on the other side, the medical fraternity was a little bit reluctant. We did many camps outside in all the engineering colleges. The students of the engineering colleges, arts colleges were very, very supportive and they wanted to donate blood. And slowly the culture of donating blood had increased. Now we can see doctors also very much involved in the donation of blood and also organs. Now we can see the champion of blood donation, Dr. Sukumar, who has donated nearly 200 times. At the time of my activity, I searched a doctor throughout India who had donated 100 times blood 100 times of blood donation, but I couldn't find anyone. Now there must be many people, and top of the list should be Dr. Sukumar, who is amongst us championing the cause of blood donation. Similarly, Dr. Rajesh, though myself also added to the list, Rajesh and our team, many people have pledged their organ already at TRANSTAN and they got the certificate also. So I wish all the members of our medical fraternity to champion these causes of organ donation and also blood donation. I hope these activities would fulfill that objective. Thank you very much, Dr. Rajesh, for the wonderful opportunity.
Thank you, President sir, Abul Hassan sir. This few introductions and felicitations. We will straight away go for the session of the day. So the first session is today. I am going to talk about the organ donation. We will start the program. I am going to talk about the issues in brain death and organ donation. So in Tamil Nadu, the State Organ Donation Day is celebrated on 23rd September every year. And the practice of observing the September 23 as the organ donation began in Tamil Nadu after the tragic death of the 15-year-old A.P. Hitendra in 2008. His parents, Dr. Ashokan and Dr. Puspanjali, decided to donate his organs. This incident sparked the movement like a resurgence in organ donation across the state. To recognize and promote such donations, the CM M. Karnanidhi declared September 23 as the State Organ Donation Day. From that time onwards, the State Organ Donation Day is conducted. So the Organ Donation Day, when it is to be conducted, there is a lot of controversies around a lot of the people, and then the World Organ Donation Day is celebrated on the 13th of August. Like that, there are different days are there. And then another one is the National Organ Donation Day is also there. These are all some confusions which are going on, and this State Organ Donation Day is 23rd September. So this is one example I wanted to show that this is my mother. My mother immediately after the death on 3/3/2022, immediately I made arrangement to do the eye donation and the skin donation. That is what I have done. She died of myocardial infarction, sudden death. She died. And immediately I have arranged for the skin and eye donation. Like that, we doctors should be trying to encourage more people, our patients and relatives, to donate the organs. That is before death and after death also. That is a brain death patients also. We need to, we have to educate the people. Then only we will be able to get more of the organs. And why it is so important, the organ donation, which is the regular common donations, you heard about it. In the history, we had this Lord Ganesha is showing there is a head is being transplanted. That is itself the history. And second is in Kannapar, there you might have heard about that, the Kannappar's one eye, even he was going to try, suddenly God came and showed his, and there itself the Kannappar started donating his eye like that. And then third one is that in Mahabharata, our Karnan is there. Where what are all the donations he has done? All the donations, அவர் எல்லாமே தானமா கொடுத்துட்டு இருந்தாரு. அவர் செய்த தான பலன்களை அனைத்தையும் தனக்கு வேண்டும் என்று சொல்லிக்கொண்டு அவர் கிருஷ்ணன் அவர் தடுத்து நிறுத்தி அவர் அவர்கிட்ட இருக்கிறத எல்லாம் வாங்கிடுவார். ஸோ like that தர்மத்தின் பலன்கள் அனைத்தும் he was asking like that. So for example, only our இதிகாசம் are all telling about the histories. Like that he is taking and then he is handing over these all the dana dharmangal. So that's what is happening. Okay. So we should know what is brain death. Brain death is not the disease of the cerebral hemispheres, it is the disease of the brainstem. When the brainstem, the pons, midbrain and medulla oblongata, if not working, that is called the brainstem death, not the cerebral cortex or cerebellum. So brainstem is the part which is in the bottom of the brain, midbrain, pons and the medulla oblongata. If it is not functioning, that part is called as the brain death. So what are all the functions of the brainstem are awake, then blood pressure, then deglutition and eating, and then breathing, and then pulse, all these things. So what is brain death? That the total irreversible loss of function of the cerebral hemisphere and the brainstem is called as the brain death. Brain death is the condition where the brainstem, midbrain, pons and medulla oblongata, there will be dysfunctional status is present. Midbrain, pons and medulla oblongata, if they are not functioning, that is called as the brain death. So repeatedly I am showing this is the midbrain, this is the pons and this is the medulla oblongata. These three structures, if they are not functioning, that is called the brain death status. It is an irreversible unconsciousness with complete loss of the brainstem function. So what is the cause of the brain death? In the brain death column, what happens is that it is because of the tumor in the brain or the trauma in the brain, intracerebral hemorrhage and ischemia, all the problem happens in the brain. So how it occurs? It is the brain is totally affected. So wear helmet while riding a bike. So this is the normal CT scan and this is the black color is the cerebral anoxia. That is one of the scans of showing brain death. And second one is the normal brain, and there is the hyperdense areas which are called as the cerebral hemorrhages. And the third one is the subarachnoid hemorrhages. There is the bleeding in the sylvian fissure. And then fourth one is the trauma producing the skull bone fracture and underlying condition that also can lead on to this brain death. Then the infections of the brain also can produce the brain death. So like that, what are the causes of the brain death? Head injury, brain injury, spine injury, and the polytrauma, all the diseases of the brain that produces the brain death or the brainstem death. So once the intensivist, once under treatment, the intensivist decide that it is a brain death stage. Then we follow the instructions given by the TRANSTAN, Transplant Authority of Tamil Nadu, or ROTO, Regional Organ Tissue Transplant Organization, or SOTO, the State Organ and Tissue Transplant Organization. So how to find out the brain death? By coma or unresponsiveness to the deep painful stimuli. These are all decided by the intensivist and then the neuro doctors who are there in the hospital. For the organ retrieval, there is an act which is called as the Transplantation of the Human Organ Act. THOA is present, which was created in the year 1994, and it was further discussed in forums, and then following recommendations were made by the Brain Death Committee on 25/2023. The latest is what I am showing, that is what. So prerequisite to diagnose the brainstem death is evidence of irreversible brain injury of unknown etiology, irreversible loss of consciousness and cessation of spontaneous bleeding. To exclude alcohol intoxication, depressant drugs, narcotics, muscle relaxation, primary hypothermia, hypovolemic shock, metabolic and endocrine disorders. So how to confirm the brain death? There is absence of the brainstem reflexes. We have to check. The pupil fixed and dilated, corneal reflex, cough reflex and gag reflex are absent. Dorsal movement is absent. Bilateral caloric test negative, cold caloric test, no spontaneous respiration, apnea test is positive test. Flaccid extremities, deep tendon reflexes are absent. Pain response to pressure over the supraorbital ridge is not present. So they are all the ancillary tests. These are tests which were showing were the ancillary test called, and this is the confirmatory brain death. Brain death is the arteriogram. Arteriogram, the blood circulation vessels will be seen normally. If it is not seen, it is a sign of brain death. So this is the CT cerebral angiogram or digital subtraction angiogram, DSA, or MRI cerebral angiogram. In the CT cerebral angiogram, 4 points should be there. They are 100% specificity and 85% sensitivity. The 4 vessels blocked are the 4-point scoring system are right cortical branch of middle cerebral artery, M4 segment is not present. The left cortical branch of MCA, M4 segment, and right internal cerebral vein and left internal cerebral vein. For each vessel that shows lack of contrast flow, 1 point is given. If all 4 vessels show no contrast, then it is scored as 4/4. That implies the patient is brain death. Score 3/4 or less is negative for brain death. The sequence of clinical and ancillary tests are done by minimum 6 hours after the first set of performable components of the clinical brain death. If ancillary tests demonstrate angiographic findings supporting to the diagnosis of the clinical brain death, the second set of clinically performable tests are to be done immediately after the positive ancillary test. If the clinical findings are consistent with the diagnosis of the brain death, the patient is declared dead. All the above findings, that is the clinical bedside test and also this ancillary test, to be repeated 6 hours apart for the adults and 12 hours apart in case of children. In both the times, there should be informative and that should be correct both the times. Then only we can take. If the ancillary test is negative, ancillary test is giving the digital subtraction angiogram is negative, Then the time period to repeat the test, repeat after 24 hours if the strong clinical grounds of brain death persists. That is, after 24 hours only you can repeat the ancillary test to confirm the brain death. So patient should not be on a poison intake. So how to finalize the brain death? Who are all the doctors involved to finalize the brain death? The RMP in charge of the hospital in which the brainstem death has occurred, the head of the institution, RMO, ARMO or duty RMO, no clearance required from the appropriate authority. RMP in charge of the hospital, number one. Number two, neurologist and neurosurgeon, if not available, surgeon or physician and anesthetist or intensivist, empaneled by the appropriate authority. And registered medical practitioner nominated from the panel of names sent by the hospital and approved by appropriate authority, physician, surgeon, and intensivist. And RMP treating the deceased person. So 4 persons. The RMP who is treating the patient, registered medical practitioner who is treating the patient, that is number one. And number two is the RMP in charge of the hospital. That is number two. Number three is the neurologist and neurosurgeon. If they are not available, the empaneled doctors who are the surgeon, physician or anesthetist or intensivist can take the role of one of the certifying doctor. And fourth is the RMP nominated for the panel of the names of the hospital and approved by the appropriate authority, physician, surgeons or intensivist. Like that, only 4 people need to do the certification. The brain death certifier specialists that need to be empaneled with appropriate authority of brain death certification. The following specialties must be empaneled: neurophysician, neurosurgeon, anesthesiologist, intensivist, general physician, general surgeon, pediatrician, respiratory physician, and cardiologist. Why it is so important is the organ donation. More than 5 lakh people in India are dying every year just because of the failure of the organs of the major functioning organ anytime. So why it is so important is kidney failure, cardiac failure, liver failure, corneal blindness are present. So many people. So you might have seen in newspapers, விபத்தில் மூளைச்சாவு ஏற்பட்ட மாணவரின் உடல் உறுப்புகள் தானம். That is, the 7 organs can be given and that are going to cover the defect of the other people. Who is the ideal organ donor? Brain dead patients, beating heart, urine is excreting and no breathing. No breathing, beating heart, urine excreting. So organ donation is removal of the tissues or the human body from a person who is declared as the brain dead. So age and organ donation: up to 50 years kidney, heart and heart valves and lungs, up to 70 years liver, trachea, and up to 85 years skin and up to 100 years cornea can be donated. So there is a modification in the February 16, 2024. There was a modification. A citizen can now register for organ donation in any state. And previously there was an age limit about the donation of the organ or receiving the organ. No age limit to receive the organ. There was a previously limitation for the organ recipient. Now above 65 years can receive. No state limit. Any state can donate to any state. That's why the regional organ transplant, ROTO, comes into play. Any state recipient from any state. No money to be paid to the recipient registration. Who can be a donor? It can be a live donor or a deceased donor. The relations may be related. Related is the thing and unrelated is not at all taken off. And then deceased donor is cardiac death or the brain death. That is the live donor. You might have seen that the mother is donating kidney for the daughter. A mother is donating part of the liver to the children, like that. You might have seen that is the live donor. And then deceased donor is the brain death or cardiac death. Who can donate? Live in above 18 years, 1 kidney when they are alive, liver lobe, distal pancreas and lung lobe. Deceased, any age, all organs and tissues. One organ donor can save more than 8 lives in his life by donating his well-functioning organs. Another thing, a simple way to tell organs or tissue donation after brain death. What are all the organs that can be taken from after brain death? ஜென்ரலா சிம்பிளா சொல்லணும்னா கழுத்துக்கு கீழே இருக்கிற அத்தனை ஆர்கன்ஸும் எடுத்துக்கலாம்னு சொல்லுவாங்க. இதுல ஐ ஒன்று தான் மேலே, மற்றதெல்லாம் கீழே. கிட்னி, லிவர், ஹார்ட், லங், pancreas, ஸ்மால் intestine, வாய்ஸ் பாக்ஸ் ஆர் லாரிங்ஸ், ஹேண்ட், middle ear bone, skin and fascia, bone, cartilage, tendons, veins, arteries, nerves, fingers and toes. Like that, anything below the neck can be taken for the organs. And when there is a tissue organ after death also we can take. So major organ that can be donated for transplant are heart, lung, liver, kidney, pancreas and small intestine. Each tissue donation can benefit approximately 75 patients. The corneas, bone, veins, heart valves and skin can be used. Which are all the organs that can be procured are heart, intestine, kidneys and lungs. Tissue or organ donation by a living person. Living person can donate blood, bone marrow, kidney, portion of the liver, portion of the lung, portion of the pancreas. So which organ can be donated from the live person? Organs that can be donated from the living donors include part of the liver or pancreas and the kidney. There is one thing called as the green corridor. What is green corridor? You must be surprised. Tamil Nadu first state to create a green corridor. The formal name of green corridor was given in July 2020 when a hospital police in Chennai coordinated to transport a heart from one hospital to another in half the regular time. The system has been used effectively in cities such as Mumbai, Gurgaon, Hyderabad, Bengaluru, Calcutta, and Indore. Green corridors are generally used for transporting the heart. 4 to 6 hours we need to transplant. That is, the heart is very important. And the liver is 12 to 15 hours, which have the shortest preservation times. And mean of transportation is often by road, but air ambulances are also employed when the organ require transportation to different cities or states. You might have heard in the newspapers or in the TV, you might have seen. Likewise, for transporting, 13 நிமிடத்தில் எடுத்து செல்லப்பட்டது அப்படின்னு சொல்லி போட்டிருக்காங்க. So like that, we can transport by the green corridor is the non-stoply we will be able to transplant the organs from one place to another. That is the thing which we are showing. Okay. So time factor and safe organ preservation and transplantation is kidney is 48 hours, pancreas is 24 hours. Liver is 12 hours and the heart and lung is 6 hours. So the heart and lung and liver are the major things. Heart and lung is 6 hours, liver is 12 hours, the pancreas is 24 hours and kidney is 48 hours. What is the need for organ donation? 50,000 corneal transplantation only is happening. Need is 2 lakh. 5,000 kidney transplant happening. Need is 1,75,000. 1,000 liver transplant where need for 50,000. Need 50,000 heart and need 20,000 lungs per year. This is the Transplantation of the Human Organ Act. THOA was first created in 1994, which the government passed in 2008. So these are all the years of development. The Transplantation of the Human Organ Act 1994, then it converted into rules in 1995. Transplantation of the Human Organ Rules as amended Gazette in 2008, and Transplantation of the Human Organ Amendments 2011, and Transplantation of the Human Organ and Tissue Rules in 2024. So according to the Transplantation of the Human Organ Act, spouse, son, daughter, father, mother, brother, sister, grandparents, grandchildren, uncles and aunts can donate their organ for their patient, distant relatives and friends, but not others. Offense and penalties for unauthorized transplantation under Transplantation of the Human Organ Act 2011. Removal of organ transplantation without authority is punishable 5 years jail and 10,000, which was present. and which was now enhanced to 5 lakhs and 10 years now. 5 lakh rupees and 10 years. And submission of the false documents, imprisonment up to 10 years, fine up to 20 lakhs to 1 crore. Commercial dealing in the organs, imprisonment 2 to 7 years, 2011 Act 5 to 10 years. Fines from rupees 10,000 to 20,000, which was increased to 20 lakhs to 1 crore. Penalty for doctors, first offense, name removed from the state medical register for 3 years. They cannot practice. Subsequent offense, name removed permanently. Now we will come to some parts of the eye donation. Eye donation is the blind population in India, 30% of the global population blindness, visually impaired 52 million, blind children 1 in every 1,000 children. Annual collection is 40,720, annual addition is 20 to 25,000 people. Corneal blindness affects mainly children and young adults who have a long life ahead of them. Can you imagine your life in darkness? Eyes are precious. 1.8 million corneal blind in India, out of which 1 million are children. What is cornea? The cornea is the area which is in front of the alveolar, the transparent structure. That is only is the cornea where it is getting transplanted. What can you do is learn about eye donation, pledge to donate the eye, and encourage people around you to pledge. Let eye donation become a tradition in your family. Donate eyes of your dearest after death. So, eye donation facts. Call the nearest eye bank, switch off the fans in the rooms and keep AC on. Place wet cotton or closed eyes of the toner and raise the head of the pillow. Myths about the eye donation. Face or body will be disfigured, will be born blind in the next birth, will not be able to see the God. This was their false informations. Who can donate? No age bar. Anyone can donate. Who can donate eyes? Any gender can donate eyes. Families can donate the eyes of their dear departed, even it has not been pledged when they are alive. If the attenders, the son and daughter, are willing to donate, then they can do it. Nothing wrong in doing. All religions endorse the practice of the eye donation. If some religion is not allowing, we will leave it off. We won't force anyone. People, if they are willing, we will start taking it. Who cannot donate the eyes are when there is an infection, for example, hepatitis, AIDS, encephalitis, rabies, septicemia, retinoblastoma, leukemia, lymphoma, end-stage cancer, Creutzfeldt-Jakob syndrome. Consult with your physician if you are fit to be a donor. After donation, the donor family receive a certificate of appreciation from the eye bank. Eyes are evaluated for eye bank and only the ones deemed suitable are used for transplant. Others are used for research and education. Corneal transplantation should be done within 2 to 3 days post removal. Recipients are notified on a first come first served basis of the registry. Why destroy God's gift when you can donate it? Do not burn, do not bury, donate eyes. Twinkle, twinkle, little star, he really wonder what they are. Donate the eyes, give the sight. Donate eye, give the sight today, pledge. Hand transplant, right hand to left hand. This is the, for example, we are showing. If there is an injury below the elbow, from the elbow onwards also we can do the transplant. That also if the other structures are injured, that can be used. This is what, here it is injured like this here and here. And this limb is not at all cannot be used. So we need to amputate here. But if the other limb is all right, then that limb can be used here to anastomose here. That is the hand transplant. So if the hand is transplant like this, we can take it up and then we can put it like that. Like this. Big team is needed. Hand transplant right hand to left hand. Hand transplant right hand to left hand. See, this is what they have done. See, one hand cannot be used. The other hand was used. One among the 2 skin banks in South India is present at the Ganga hospital where I am working. Skin banking is a facility where skin is collected from the eligible deceased donor, which is then processed, preserved, and distributed as in international protocols. Burn accidents every day produces this skin loss. The skin is the largest organ in the human body, measuring 20 square feet and weighing 3.5 kilogram on average. It plays a crucial role on the body's protective cover, regulating the body temperature and protecting our bodies from damage and infection. The cross-section of the skin and the level of the injury or burns. Normal, first degree, superficial epidermis, then dermis, and then subcutaneous is the third degree burn. Why a skin burn? See here, for example, there is a skin burn is here in the chest and abdomen, in the both the lower limbs up to the leg it is present. And for this area, if we take the skin from the dorsum, that is in the back, that also getting affected and this also already affected, there is a chances for dehydration and inadequate fluid management and septicemia and all those things can happen. So the causes of the death in the major burns are dead skin causes infection. If we remove dead skin, then again the raw area is open for infection. In a major burns, there is not enough skin to replace from the patient. That's why skin bank skin also use. Here in a major burn like this, if we take the skin from the other area, what happened? That also will open. So like that, if it is taken, it is more of it is open. So there is more of the disease process is going on. So if you take the skin from the skin bank, this area is protected. So skin from the bank is covered over the raw area. Remove the dead burned skin early. The skin from the bank protects the individual for about 2 to 3 weeks. In that period, patient picks up the channel condition slowly in increased stages. We replace it with his own skin. Who can donate? Anyone beyond 17 years? Who do suffer from HIV, hepatitis? We cannot donate, or in septic disorders taken within 6 hours of death, similar to eye donation. After death, the next skin disease inform, and then they take the consent from the patient's relatives, and then they take a blood sample to rule out the infective diseases. And then common side of the skin harvesting is skin harvested from the 6 hours of the demise, and with the skin layer 0.5 millimeter thickness in this skin harvested area not obviously shown, no bleeding. Because the patients are dead. Skin harvesting is done with the dermatome, and then the body is covered like this and put it in the glycerol, preserved in the glycerol. And in the lab, they are taken, and then in the skin bank, the trimming of the skin and the sample is done. And the glycerol is added to skin sample. Skin is stored at 5 degrees Celsius, and then it is meshed like this, and then it is kept in the preserved in a bottle that can be used for the patients. And this is one home skin taken. That is the patient's, you see the patient's home bed. And there the bed, we put up a nice cloth without soiling the area. They take the skin from the patients with the help of the knife. So like this it is taken. Both the sides of the legs and all those things, and also over the dorsum of the back of the patient. So the skin is taken. And after that, it is covered well like this without showing any of these areas, and then body covered with the dress. In home house skin taken, this is what, and this posted into the glass roll. The skin donation. One of my mother's sister's husband died on 21/3/2024 due to old age at home. Immediately, I've arranged for eye donation and skin donation at their home. This is the 5th such donation I am arranging in 2 years. Who can receive? Anyone can receive, because blood and tissue typing is no bar. The process of preservation removes the antigenicity, and so it can be used by anyone. When you donate eyes, you give vision. When you donate skin, you give life. Value is that this is attached to a burn unit where we can use the skin and save lives. Skin donor card is the card which is issued, and this is the contact number of the skin bank of the Ganga Hospital 0422 2485 and toll-free number 1800 425 16,000. How to prevent brain death? Prevent the brain death, avoid head injuries. The helmet protects our brain like a mother protecting the child in the uterus, like this. And then the seat belt also helps us. If we carry more people, there is chances for injury and chances of brain death. Take care of your head. Not everyone gets a replacement like a Vinayaka. We need to send some ads like this and then get the patient's consents. This is what we used to do.
உலக தலைக்காயம் விழிப்புணர்வு நாள் மார்ச் 20 பெரும்பாலான விபத்துகளில் உயிர் சேதத்திற்கும் நிரந்தர ஊனத்திற்கும் தலைக்காயமே காரணம். இதை தடுக்க தலைக்கவசமே மிக சிறந்த வழி. தலைக்கவசம் அணிவதன் மூலம் தலைக்காயத்தில்
Like this, the accident cases, and then the road safety week of celebrations. At the time, people used to educate more people. And another concept which I want to talk about today is the body donation. There is a procedure can pledge with when you are alive. Relatives can donate as per the wish of the dead person. Body donated to the medical colleges. Only the government medical colleges are allowed to receive the body from the in Tamil Nadu. No compensations are given. So this is one example, one of the doctors, Dr. S. Balakrishnan, when he pledged, and then this is from the Department of Anatomy, the certificate is given, and that certificate is used, and then that is being used, and that is what happening. And like that, so many people have donated. Body donation by Dr. Balakrishnan, Tanjore. This is my donation certificate, donation of my body to the Coimbatore Medical College. We appreciate your gesture by donating your body to your institution's study purpose of students. We have registered your name in your registers. Like this, they give see a registration number and all. Registration register, body donation register, everything is mentioned. It is done in 2021 itself. We have done it. Like this is my wife's. Our Sumadhi is my wife. We both have donated. Don't take your organs to heaven, for heaven knows they are needed there. Life, pass it on. If you want to give a life pledge with, this is a example on Mohan Foundation, Multiple Organ Harvesting Aid Network Foundation. This is the first foundation who created this donation concepts long back in 90s, and subsequently TRANSTAN came into work and they started working on it, and then they created this ROTO and NOTO, Regional Organ Tissue Transplant Organization, National Organ Tissue Transplant Organization. Where we stand in comparison to Western countries, only 0.201% Indians pledge to donate their organ, with respect to around 70 to 80% in Europe and USA. Surprisingly, when it comes to donation in India, women are donating more than men, 20 is to 80%. Where we stand in India, in the foreign countries, they are around 35 per million population. The United States also like that, where we have only 0.01% only is in our country. Organ donation is in India is regulated by Transplantation, Human Organ Tissue 1994, by the National Organ Tissue, and Tamil Nadu is the TRANSTAN, like that. In 2019, the government of India implemented the National Organ Transplant Program with a budget of 145 crores for promoting diseased organ donation. In Tamil Nadu, brain death certification mandatory in 2008, becoming first Indian state to do so. Between 2008 to 2019, after restarting organ trade with no new regulations, the state recorded 7,783 organ transplants. Now it has reached around 12,000 now. When recent the statistics I will show you. Like this, they have got what are all the organs which are donated, government, private, total, all the things they are having. Each and every year they are having. Organ transplantation in Tamil Nadu, already I have told about the Hitendra effect. And that only created, however, from 2018, organ donations in the state dropped due to some controversies. And in 2019, Tamil Nadu recorded only 128 donors. In 2019, the state had transplanted 7,783 organs from the deceased donors. This TRANSTAN is the Transplant Authority of Tamil Nadu, a registered society formed by GO 396. Under the chairmanship of the Honorable Chief Minister of Tamil Nadu, the general body consists 21 members, including Honorable Minister of Health and Family Welfare. Transplant entire functions are overseen by an executive committee, which includes the Principal Secretary to Government of Tamil Nadu Health and Family Welfare Department. The TRANSTAN also functions as the Regional Organ and Tissue Transplant Organization, State Organ and Tissue Transplant Organization by Government of India and was registered as a society of on 18 March 2015. Cadaver transplant program is one of the programs run by TRANSTAN and will also coordinate and supervise the entire range of transplant activities, including liver transplant, cadaver transplant, and tissue transplants. See, this is the address of the TRANSTAN in Chennai. First floor, Tamil Nadu government multi-specialty, super specialty, Omandora government estate, opposite to Hindu office, Anna statue, and Chennai. How to donate it is from Coimbatore. I have created this one, which is the Eye, Aravind Eye Hospital, Sankara Eye Hospital, Eye Foundation, Lotus Skin and Bone. Like this, all these things what I have talked now will be published in the leadership manual, which is going to be issued during the leadership meeting in Coimbatore on 9th February. From that, people can take a copy of it and keep it with them. So what is the procedure when there is a brain death? Brain death, inform the TRANSTAN. 6 hours, the second declaration, and the family willing brain death, inform TRANSTAN once again, and then allocation process. If MLC, police intimation, inquest and forensic clearance. The fee is 25,000 per organ to the donor hospital, maximum 75,000 from the recipient hospital is to be given for each organ, actually. That is only allowed, nothing else. So what is the procedure? Already we have told about the structures: heart 4 to 6 hours, lung 4 to 8 hours, intestine 6 to 10 hours, liver 12 to 15 hours, pancreas 12 to 24 hours, kidneys. Like this, 8 lives that that person can save if all the organs are fit to be transplanted. 1.51 lakh road accident death reported in India in 2016. Highest in the world, followed by China, 58,022, says a World Health Organization report. So these are all the things actually. See how elaborately it was. It is a cutting from the Times of India. See how they are explaining. A general surgeon or neurosurgeon identifies a potential brain death person from ICU. Transplant coordinators inform. Transplant coordinators do grief release counseling of the bereaved family to get its consent. Consent is documented. In medical legal cases, no objection certificate taken from police. Brain death certification committee is informed with the treating physician, that is neurosurgeon, the medical specialist, and expert from the hospital administration. See, here itself they are showing only 4 people. The committee conducts a battery of tests to rule out the survival. They are all the clinical bedside test and ancillary tests. The committee meets again in 6 hours in case of adult and 12 hours in case of child. Donor is certified as brain death and maintained on its life support. Donor is shifted to OT for organ assessment. The waitlist recipients, 5 for each donor, are called to submit the samples for match. The best match is taken for transplant. These are all the approved list of hospital for kidney transplant, liver transplant, all the organs there are approval. We need to apply and then get an approval for all the things. In Tamil Nadu organ transplant units, there are 13 organ transplant units in government hospital across the state. And after the DMK government came to power this time, 27 government medical college hospitals were declared as non-transplant organ retrieval centers to increase donations. Waiting list for organs in Tamil Nadu in September 2023 were 6,179 patients waiting for kidney, 449 liver, 72 heart, 60 lungs, and 24 heart and lung. So these are all about the active waiting list of all the organs and tissues. And this is what the activity which is showing. I was telling about 7,000 in 2001 and now it is 2024. It is 11,377 total organ transplant receipts. And total donation so far in Tamil Nadu, 1,726 people have donated organs in Tamil Nadu, benefiting 6,300 patients of Tamil Nadu. In the last 2.5 years till September 313 have donated organs, benefiting 1,641 organs. This is our new organ donation committee, where we have the advisor as Dr. Sukumar, chairman myself, and the co-chairman Dr. Suguna and Rasmi, and Dr. Saundarajan from Vilupuram, Dr. Bommusamy from Avinasi, Dr. B.A.B. Sivaprakasam, Dr. Vijayanand Palisamy, Dr. Arabindra from Madurai, Dr. V. Jayaraj from Madurai, and Dr. Kanagachalakumar from Erode, Dr. G. Murugan from Dharmapuri, Dr. P.V. Ramesh from Kallakurichi, Dr. D. Nailesh from Velu, Dr. Rajesh Sengodan. This is the new emblem which I have already shown when I initial talk. And the organ donation awareness meeting, we need to conduct organ donation awareness meeting in all the medical colleges, nursing colleges. Even our medical people don't know what all the organs can be donated like that. All the engineering colleges, Rotary clubs, Lions Club, and like forums in the IMA region branch areas. This is the handout which we are going to modify the English and Tamil. And to increase awareness, if a person with the brain death donates the organ, the local branch IMA office bearers to meet the relative during the funeral or after and thank them by giving a citation. In IMA meeting, at least 5 minutes to be allotted for each of the organs, and then organ donation, and then that it also will educate more of the people. The organ donation workshop, to conduct a regional organ donation awareness workshop to college students, paramedical staffs, and doctors, so that all the procedures can be expedited. Educate more people. Hospital coordination meet, to conduct regional donor hospital coordination meet by inviting donor, recipient, and transplant hospital doctors, and conduct meeting once in a month with the organ donation committee members of IMA TNSB. The registry is created in the TRANSTAN. This is the organ donor card which I have already shown. In this card you can see organ donor card. Donate organs, save lives. உறுப்புதானம் செய்வோம், உயிர்களை காப்போம். My date of birth, and then my group, and then what are all the organs that are donated may be used for treatment of others, மற்றவை சிகிச்சை, and then in case of any emergency தொடர்பு கொள்ள வேண்டிய எண். This is my son phone number. Like this we need to register in the TRANSTAN website. Okay, like that we have in Tamil Nadu IMA also, and also we have a Google Forms for registration. And this is about IMA TNSB website, which is showing how to do it. That we will put it in the coming time of bulletin also. Registration for general public also, we will create a Google form like this for the doctor separately and for the public separately. And separate Google form will be given. To increase awareness about organ donation, awards for the good performing branches with maximum donor registration in our website. Branch conducting maximum donor awareness meetings to be given during the state conference. Then about the World Organ Donation Day, already I have told, every year August 13, all people should consider themselves potential organ and tissue organs donors regardless of their age, health, race or ethnicity. And then government conducting felicitations to the people for the organ donation pledge. And from that time onwards, when the person is dead, the government officials go and meet the people and then thank them. That's what they are doing. And this is on an amazing picture. The Abdul Rahim, an Afghan soldier who lost both his hands in the war, received a pair of hands from Joseph of Kerala, Joseph's daughter and wife. Looking at the hands, the transplant surgery performed by Dr. K. Subramanian Iyer, blue shirt of the Amrita Hospital, a Hindu doctor, a Christian donor, and a Muslim recipient. That is humanity. Then our like this, if we start educating our public by showing the movie clippings. This is Chennaiil Ornal movie clipping which came like that. Like that, we also need to get more of the advertisements from more of the people, and then we will start doing it. That's what we need to do it. Like this. So even after doing so much of work and all those things, people, we need to honor our grief counselors. Top performing hospitals, we need to felicitate them. The police personnel who facilitate the swift transport of organs through, and ambulance drivers, the doctors and voluntary organizations and organ donor clubs, we need to give them more of the recognition. Then only it will be more publicized. Thank you one and all for the patient listening. I have covered everything, and if you people have any doubt, we will have discussion at the end of our Dr. Sugumar advices talk. Thank you one and all. Now I invite Dr. Sugumar sir to give his lecture on blood donation.
Chairman sir, good evening, President sir, and secretary and everybody, sir, and members. But Rajesh asked me, I said, no, yours will be very vast. So many organs, so many things are there. So I said that Rajesh will talk first because only about blood donation, everybody knows about blood donation. All are giving blood donation. So we have to just highlight a few points for blood donation. Actually, our World Blood Donation Day falls on June 14th. Our National Blood Donation Day falls on October 1st. Every year, so many people are donating blood, but we need a lot of blood. In India, who was a past president, he donated his father's body after the death to the medical college. One Dr. Ganapati from Erode, he is the past president of Erode IMA. He donated his mother's body. He and his elderly father, they went to Salem Medical College, donated the mother's body. Rituals family. From that family, they got permission from the parent, from the family members, and donated his mother's body to the Salem Medical College. These two things always sits in my mind. And now Dr. Rajesh said they have pledged body to, they have led the body. That's a great thing. And regarding this eye donation, Dr. Balasubramaniam from Udumalpet, he has retrieved around 1,400 pairs of eyes. Whoever is dead, immediately he will be informed in that Udumalpet area. He will go and retrieve. It's a real great thing. Now, as his elderly, is not going. It's a great thing that a doctor who is not an ophthalmologist went and retrieved eyes. That's a great thing. Regarding blood donation, usually we conduct blood donation camps. Every blood bank conducts blood donation camps. For mainly who can donate blood means person between the age of after completing 18, from the age of 19 and 65, he can donate blood. If men, they can donate blood once in 3 months. Women, they can donate blood once in 4 months. That is from, I calculated, I started donating from the age of 19. So the blood bank medical officer, Dr. Chitra Soundarajan, and the office people said, sir, animal varadinga. That's why I was able to donate for 192 times. And now they have stopped. They have asked me not to come. One Mr. from Rajashekar from Chennai, he has donated 187 times. But the problem is when he started donating, he was donating every month. He will go to those days. He will go to Madras Medical College one day, Stanley Medical College 1 month, Stanley 1 month, the next day Kilper Medical. Only 3 medical colleges were there. Then when the medical officers came to know about it, they said that then they made him donate about 180, he has done 191 times. That's a great thing. A non-medical man donating blood is a great thing. And in olden days, when we were on shortage of blood, nobody will come for blood donation. In those days, when an MGR film comes, we'll get more blood. How it means? The people will come and donate blood, get the money and go and see MGR movie. And when MGR died, when MGR was shot, he was given blood transfusion. Then he started calling everybody during the meeting, Rattatin Rattangale. He used to say, when I was shot, I was given blood by many people. I don't know who gave it. So that's why I address everybody as Rattatin Rattangale. Whenever blood donation meeting, we think of MGR. And who can donate blood? What age means? Person more than 45 kg can donate blood. And the hemoglobin will be 12.2. It should not be less than 12.2 milligrams. That is, we should not have had any. We found out about the function of the heart and blood circulation. From 1916, William Harvey found out about the function of the heart and blood circulation in 1616. Then 1665, THOA documented the demonstration of blood transfusion between 2 dogs. Then Pope banned should not be demonstrated. For a few years, for about a decade, they didn't do anything. And in 1873, cow milk and goat milk were transfused for human as per American records. But in 1901, Dr. Carl Lindstein, by discovering the AB and O blood grouping solely, was awarded Nobel Prize in 1930 for this discovery. Carl Nobel Landsteiner தான் உண்மையிலேயே blood donationக்கு father. Then who can, in those days, O group can be universal donor and universal donor. Nowadays, we never create any other groups. Nowadays, only groups are transferred to the same group. Now, what we are doing is, nowadays, they are not at all giving whole blood. Whole blood is very rarely given. They are separating it into platelets, fresh frozen plasma, cryoprecipitate, and PRPC. That is, if you are giving it as a platelet, it's only if a unit of blood is collected or 450 we collect, only 50 ml of platelets are collected. Fresh frozen plasma platelets are collected. Fresh frozen plasma about 50 ml. And this can be preserved. How many days now? Platelets can be preserved only for 1 year or Cornea. But platelets can be for about 5 days. Cryoprecipitate 1 year. PRPC for 35 days. Whole blood can be preserved for 35 days. But nowadays, no blood bank is giving whole blood. Very rarely we get whole blood. Only government hospitals are giving to others also. Dr. Rajesh sent a message that, sir, 104. So we received as WhatsApp. 104. If we ring up 104, we can get blood. I inquired in the GH medical college. They said we have not received any communication regarding 104 number. If we receive it, they will inform us. These are the things. And regarding our IMA, we have to inform all the branches to conduct blood donation camps. Because it's only thing. அதாவது நம்ம உயிரோடு இருக்கும் பொழுது நம் உடம்பிலிருந்து கொடுக்க போகுது. They say அன்னதானம், கோதானம், உறுப்பு தானம், everything. But உறுப்பு தானம் means, as he was telling, when we are alive, we can give a kidney, part of liver, everything. But every 3 months or every 4 months, we are able to give only blood. Many of the doctors are giving, and every time they will check the blood and take it. Person having malaria or rabies, who was bitten and all not be taken. Who is having jaundice, who is having cancer, we will take blood. We have to get the AIDS, we cannot take. How much blood can be taken? We are having 5.5 liters of blood. Every time we can take up to 450 milliliter of blood. Most of the places they take only 350 and 50 ml will be in the bag. So they will be giving 400 units of 400 cc of blood to the people who are asking for it. Blood out there. Blood transfer cross matching is done, and the comparison may be different patients according to the requirements. WHO organized Blood Donors Day as 14 June, and I already told that our National Blood Donation Day is October 1st. More than 81 million units of blood were being collected annually every year. Madras Medical College was started in 1949, the largest blood bank in the country. Every year, 22,000 units are being collected, and components are about 50,000 units. This is about the blood thing, and thing most of the people know. Regarding the awards and other things, every branch, we are requesting all the branches to conduct blood donation camps, especially during the whole blood donation day and the thing. For the past few years, what we are doing is, from 30th, this today, Gandhi's short day, the Gandhi Memorial Day to October 2nd, Gandhi Jayanti. We are asking the branches to collect, go to collect and donation camps, and they have to send the report every year, every month. They have to send the report. Whenever they go for the blood donation camps, they must collect the get the signature of the blood bank medical officer, so that every month you can send the report to the IMA headquarters, your state office, and your branch, and to the chairman of the organ blood donation committee. The Rajesh will be getting that is data from all the branches. Whoever conducts, they have to send it. There are so many branches, so many awards are also there. At the national level, maximum number of units are collected by a branch is there. In Tamil Nadu, maximum number of units of collected by a branch. There are three: number 1, number 2, 3, third places. And in number of doctors, IMA members donating blood, number 1, number 2, number 3, there is 3 awards are there. Number of camps conducted by a branch, first, second, third. So 9 awards are there as far as Tamil Nadu is concerned. In the center, there is 1 award. If a branch is interested, they can, as Dr. Rajesh was telling, they are going to award the people who are conducting maximum number of organ awareness camps, and who is going to do organ awareness, other things, rallies, everything. Even in blood donation also, same thing is going to happen, but we want all the branch secretaries and president to take more interest. உயிரோடு இருக்கும்போது நான் முதலே சொன்னேன், சந்தோஷமா ஒரே ஒரு எந்த விதமான ப்ராப்ளம் இல்லை. ஒன்ஸ் we donate, nothing will happen. When I started this my 3rd year, I just went to the they were I was Stanley into the blood bank. That time it was about 7 months. Went back to the ward. After that, every month, 3 months I was donating. I used to go to play. அதில் வேலை போனாலும் இல்லை, எங்கே போனாலும் இல்லை. அதாவது சம்திங் எக்ஸசைஸ், அதாவது ஆஃப்டர் த மேரேஜ் நோ ப்ராப்ளம் ஃபார் அவர் family life, anything, no problem at all. Once in 3 months, regularly we can go and give. Ladies can go and give once in 4 months. Blood donation camps to be conducted by the branches, and the reporting is very, very important. We want the medical officer signature in that and give it. Please send it to Dr. Rajesh, State Office, IMA headquarters. Then our branch, your branch also must have it. Then only you can get the award also. These are the few things I wanted to tell, because most of the things regarding organ donation and other things Rajesh was telling very nicely. So it was very good. That's why for blood donation, I said there's no need of that much slides. Only few slides are needed, and I prepared and given it. You would have seen one: initiate, motive, and adapt. When I was president, we had to give a slogan. Every president has to give a slogan. One Dr. Babu Rajendran, he was an ophthalmologist. He said, "Ni IMA irukka, I will create and solite with IMA is coming. Initiate, motivate, adapt organ blood donations." Solite IMA, that was created by Dr. Babu. He is late. Dr. Babu Rajendran, he was ophthalmic surgeon in Chennai. This is always with us, and I request all the branches to contact Dr. Rajesh for organ donation and blood donation. And all the best for everybody, and please do things. Thank you.
Those who have the doubts can ask doubts here. Chandrasekhar Mahalingam, doubt. கேளுங்க சார்.
Sir, Sukumar sir, Dr. Sundaramurthy from Chennai South.
சொல்லுங்க சார்.
Any scope for artificial blood in future?
சார் தெரியல சார், எனக்கு உண்மையாவே தெரியாது. அதாவது வர்றதுக்கு வாய்ப்பு இருக்கும் சார், எதுவுமே, பட் தெரியும். அது திங்கே பண்ணலைங்க சார்.
Okay. Sir Rajesh Babu sir.
Yes sir.
Any role for stem cell therapy as alternative to organ donation?
Sir, it cannot be an alternative, sir. It's only an initiator only, no sir. The stem cell is only an initiator.
இன்னும் ப்ராசஸ் ஆகல இல்லையா?
We cannot replace the hemoglobin level. That is not possible with the stem cell therapy, sir. Stem cell is having certain indications and all those things.
Okay.
It can induce a little bit, but 100% we cannot guarantee.
Okay.
That is the main thing, sir.
Okay. So only last question, sir. Ethnic and legal issues, any particular specific ஏதாவது ethnic and legal issues இருக்கா? இல்லைன்னா
எதுக்கு?
specific for organ donation.
ஸோ ஆர்கன் டொனேஷனுக்கு வந்து அந்தந்த ரிலிஜன்காரங்க என்ன பண்ணுறாங்களோ அதை அவங்க தான் பண்ணுவாங்க. Some of the religions are not at all, they are not willing to do it.
Exactly.
Only one religion, they are not at all interested. The rest of the things, what they also receive, no, that they can do it. But I don't know about the relative donors in that group. So how they
Okay.
are doing it, we don't know, sir. That is the problem. We need, but in Saudi and all those things also, there are transplant is happening, and also the brain dead organ donation transplant is going on, and even in Saudi Arabia it is happening, sir. So why can't they follow the same rules in our country also, the people? That is the main thing, sir. Yes, sir.
சார் அங்க ஒரு ஃபாரின் கண்ட்ரில if they donate organ, அவங்க ஒரு கிட்னி எது கொடுத்தாலும் they will be looked after that. They have to deposit some money in the family and name, and they will be looked after. மாதிரி the rule itself is there. It need not be related donors.
Sir, on the மாதிரி some of the things, the government வந்து have to come out with some of the things, sir. For the family who are, அதுக்கு தாங்க சார், some of the things we need to discuss from IMA level to the state ministers and the chief minister, like that, so that we can do. There are a lot of things are there, sir. அதுல வந்து some of the things what we can think about is, number one is about the compensation that is given for the families who are donating the organs. அவங்களுக்கு கொடுக்கறதுக்கு கொஞ்சம் they can start doing it. At least from the brain death people. For the brain death people, they can tell that they can give some jobs like that, or some of the preferences ஏதாவது கொடுக்குற மாதிரி, அந்த மாதிரி எல்லாம் கொஞ்சம் packages மாதிரி சொன்னாங்கன்னு சொன்னா, so many things the government is giving to the people. Why can't they think about this? And that too, they can create a corpus funding, sir, from the people who are receiving, no, from the receiving people. The government can tell that they need to pay some amount of money to the government account, so that it will come to the government account, so that அந்த மணியை வச்சுட்டு the backupல வந்து they can do some benefits to the families of the organ donation. That type of things we can write it to the government. That is one thing, sir. The another thing is, நான் அன்னைக்கே சொல்லிட்டு இருந்த மாதிரி, இந்த டிரைவிங் லைசன்ஸ்ல வந்து கொடுத்துருப்பாங்க, நம்ம வந்து வில்லிங்னஸ் ஃபார் ஆர்கன் டொனேஷனுக்கு வந்து நாம போய் ஆர்கன் டொனேஷன் கார்டு வந்து ரெஜிஸ்டர் பண்ற மாதிரி, இந்த டிரைவிங் லைசன்ஸ்லயே ஒரு அப்ளிகேஷன்ல ஒரு கொஸ்டின் இருக்கு. ஆர் யூ வில்லிங் டு டொனேட் த ஆர்கன்ஸ், எஸ் ஆர் நோ அப்படின்னு போட்டிருப்பாங்க. ஒய்ன்னு போட்டா எஸ் நோ. இப்போ நான் கூட இப்போ ரீசெண்டாக வந்து ஐ அப்ளைட் ஃபார் அ டிரைவிங் லைசன்ஸ். இந்த டிரைவிங் லைசன்ஸ் இட் இஸ் ஷோயிங் ஒய் எஸ்ன்னு போட்டிருக்குது. ஸோ அந்த மாதிரி இருக்கு. ஸோ அதனால, பட் என்ன பண்ணலாம்னா, the government can bring a rule that only when you are willing to donate your organs, the license will be given சொல்லி கம்பல்சரி ஒரு ரூலே போடலாம். தப்பே கிடையாது, கட்டாயம் கொண்டு வரலாங்க சார். அது வந்து ஒரு பெரிய பிரச்சனையே கிடையாது. கவர்மெண்ட் கேன் பிரிங் a rule like that. பிகாஸ் அது மாதிரி கொண்டு வந்தோம்னா, இது காமனாக வந்து எல்லாருமே வந்து ஆர்கன் டொனேஸ் ஆயிடுவாங்க. when they are going for a brain death, they can donate the organsங்கிற ஸ்டேஜ் ஒன்று வந்துடும். அப்போ வந்து we will have plenty number of organs, sir. Actually, on the statistics, what the government was the transplant இருந்து அனுப்புனது தான் பார்த்தீங்கன்னா, இதில் வந்து இப்போ ரீசெண்டாக வந்து டாக்டர் கோபாலகிருஷ்ணன் அனுப்புனாரு 2024. the number of donors in Tamil Nadu very high, சார்னு சொல்லி அவர் அந்த கிராஃபே நீங்கள் பார்த்தாலே தெரியும். அந்த 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 கிராஃப்ல பார்த்தாலே தெரியும், which is showing the number of donors 268 அப்படின்னு சொல்லி போட்டு வந்திருக்கு. ஸோ அந்த மாதிரி, ஸோ இட் இஸ் வெரி மச் ஹை. ஸோ அதனால ரொம்ப பாப்புலாரிட்டி பண்ண தான் வந்து people will be getting more of the organ donations and they will be able to do it. That is the main thing, sir.
சார் ஆர்கன் டொனேஷன் ஃபிட் ஆகாத பாடி வந்து டீச்சிங் பர்பஸ்க்கு அனுப்புறாங்களா? எனி ஐடியா?
அனுப்பலாம் சார்.
ஓகே,
they can send, sir.
Sir, this is Dr. Magesh from Vellore IMA.
Yes, sir. Welcome, sir.
வெல்கம் சார். நல்ல டாபிக் சார், நல்லா இன்ட்ரெஸ்டிங்காக இருந்தது. சார் ஒரு டவுட்டு ஒன்று வந்து, இப்போ ஆர்கன் டொனேஷனில் வந்து இனிஷியலி வி யூஸ் டு சே தட் ஹெப்படைட்டிஸ் பாசிட்டிவ் ஆர் ஹெச்ஐவி இந்த மாதிரி உங்ககிட்ட ஆர்கன்ஸ் எடுக்க மாட்டோம்னு சொன்னோம். தென் நவ் இட் ஹஸ் பிகம் லைக் they can be harvested and utilized for HIV positive patient or a hepatitis B positive patient who needs an organ அப்படின்னு சொல்றாங்க இப்ப.
It is happening, sir.
அதான் ஸோ அது மாதிரி இப்போ பிளட் டிரான்ஸ்ஃபியூஷனுக்கு வந்து பிளட் டொனேஷனுக்கு வந்து ஹெச்ஐவி ஹெப்படைட்டிஸ்லாம் எடுக்க மாட்டோம்னு சொல்கிறாங்க. வெதர் தட் கேன் பி செப்பரேட்லி ஸ்டோர்ட் அண்ட் கிவன் ஃபார் சிமிலர்லி இன்ஃபெக்டட் பேஷண்ட்ஸ் அந்த மாதிரி ஏதாவது ஆப்ஷன் இப்போ வந்திருக்கா அப்படின்றது ஒரு டவுட்.
சார் இது வரைக்கும் யாரும் வந்து அந்த மாதிரி வந்து ஆப்ஷன்ஸ் எடுக்கிறது இல்லைங்க சார். பட் அது வந்து நீங்க சொல்ற மாதிரி இப்போ வந்து இப்போ அதுல ஹெப்படைட்டிஸ் பி ஹெப்படைட்டிஸ் பாசிட்டிவ் பேஷண்ட்ஸ் இருப்பாங்க, ஹெச்ஐவி பாசிட்டிவ் பேஷண்ட்ஸ் இருப்பாங்க. அவங்களுக்கு பிளட் எங்க இருந்து கொடுக்கறது? அவங்களுக்கு பியூர் பிளட் கொடுக்கணும்னு அவசியம் இல்லை. அவங்களுக்கு அந்த பிளட் கூட யூஸ் பண்ணலாம்.
அதான் சிமிலர் டு ஆர்கன் டொனேஷன் இந்த அவென்யூவும் எக்ஸ்ப்ளோர் பண்ணலாம் அப்படின்றது என்னோட.
அதுதான் சார், நம்ம லாட் ஆஃப் திங்ஸ் ஆர் தேர் சார். அதனால அது வந்து ஸ்பெஷலிஸ்ட் உட்கார்ந்து கொஞ்சம் அனாலிசிஸ் பண்ணாதான் வந்து we can come to a conclusion and we can modify some of the rules and regulations. ரூல்ஸ் அண்ட் ரெகுலேஷன் நம்ம தான் கிரியேட் பண்ணி ரெகுலேட் பண்ணணும் சார்.
ஆமா சார்.
டிஃபிகல்ட்டி.
ஆக்சுவலி 2020ல ஐ வாஸ் சஜஸ்டிங் சார், ஐ வாஸ் தி ஆர்கன் டொனேஷன் கமிட்டி சேர்மன். நம்ம வந்து இந்த ஆர்கன் டொனேஷன் வந்து வில்லிங்னஸ் வந்து ஆர்டிஓ ஆஃபீஸில் டிரைவிங் லைசன்ஸில் கொண்டு வரணும் அப்படின்னு சொல்லிக்கிட்டு இருந்தேன் இப்போ. ஸோ நவ் ஐ எம் கிளாட் டு நோ தட் இட் இஸ் ஆல்ரெடி தேர். அண்ட்
சார் அதுதான் சார், அதுதான் நானும் அதே மாதிரி தான் அதுக்கப்புறம் வந்து ரொம்ப திங்க் பண்ணிட்டே இருந்தேன் சார். கடைசியில வந்து டிரைவிங் லைசன்ஸ் வந்து நான் இப்போ அப்ளை பண்ண போறப்போ அந்த இப்போ வந்து ஆன்லைன்ல தான் அப்ளை பண்ணணும். ஆன்லைன்ல அப்ளை பண்ற போது அந்த கொஸ்டின் இருக்கு. இந்த கொஸ்டின் வந்து எஸ் ஆர் நோன்னு கொடுத்துருக்காங்க. அப்போ அது வந்து உங்களுக்கு லைசன்ஸ்லேயே வந்து இட் இஸ் கம்மிங் ஆஸ் YRN வருது. ஸோ அதுல வந்து ஆர்கன் டொனேஷன் போட்டு ஒய்ன்னு வந்துடுது. ஸோ இந்த ரூல் வந்து ஆக்சுவலா வந்து கவர்மெண்ட்டை வந்து கம்பல் பண்ணலாம். நீங்க வந்து எல்லாருமே எஸ்ன்னு கொடுத்தா தான் உங்களுக்கு லைசன்ஸ் கொடுப்போம், இல்லைன்னா கொடுக்க மாட்டேன்னு சொல்லி ஒரு ரூலே போடலாம், தப்பு கிடையாது.
இல்லை அது அப்படி போட்டோம்னா சார் அது என்னன்னா, இஃப் வி புட் தட் லைக் தட் இட் வில் பிகம் நாட் டொனேஷன், இட் பிகம்ஸ் லைக் அ கம்பல்சரி திங். அதை ஒரு வாலண்டரியா அவங்க தே ஷுட் கம் ஃபார்வர்ட் வாலண்டரின்றதுக்காக அதை போடலன்னு நினைக்கிறேன் நான்.
இல்ல அது வந்து நாம வந்து
ரெண்டாவது
எஜுகேட் பண்ணணும் சார் நம்ம.
இல்லை அதான் வி ஹேவ் டு டூ தி பப்ளிக் எஜுகேஷன். அண்ட் அதான் சார் இப்போ வந்து ஐ ஜஸ்ட் வாண்டட் டு லெட் யூ நோ, இப்போ லாஸ்ட் 2 days பேக் டிட் அ ரோட் சேஃப்டி அவேர்னஸ் ப்ரோக்ராம் இன் பள்ளிகொண்டா டோல். பள்ளிகொண்டா டோலில் ஒரு ரோட் சேஃப்டி அவேர்னஸ் ப்ரோக்ராமில் ஒரு 2000 ஆர்கன் டொனேஷன் பேம்ப்ளெட்ஸ் வந்து கார் டிரைவர்ஸ் அந்த பக்கம் பிளாசாவில் போகிறவங்களுக்கும் ப்ளஸ் ஹைவே ஒர்க்கர்ஸ் அண்ட் ரோடில் ஒர்க் பண்ணுறவங்க அவங்களுக்கெல்லாம் டிஸ்ட்ரிபியூட் பண்ணோம். ஸோ ஐ ஜஸ்ட் வாண்டட் டு லெட் யூ நோ அபவுட் தட்.
நீங்க அந்த மெசேஜ் அனுப்புங்க சார் எங்களுக்கு.
அனுப்புறேன் சார் நான்.
பண்ணுங்க சார். நம்ம
ஓஎஸ் ஐ வில்
ப்ராஜெக்ட் பண்ணலாம்.
ஓகே சார்.
லைக் தட் எல்லாரும் பண்றதெல்லாம் வந்து போட்டாதான் வந்து people will start doing it சார்.
ஓஎஸ் சார்
கொடுத்த அந்த பேம்ப்ளெட்டே ரொம்ப யூஸ்ஃபுல்லா இருந்தது. அந்த பேம்ப்ளெட்டே தான் நாங்க ரெப்ளிகா பண்ணிட்டு இருக்கோம். அதை வந்து மாடிஃபை பண்ணனும். இப்போ blood and organ.
ஆமா சார், இப்போ எல்லாமே நம்ம திருப்பி ஐ வாஸ் பிளானிங் டு ரீடு தட் சார்.
நல்லா பண்ணிட்டு இருந்தீங்க ஆர்கன் டொனேஷன்ல.
தேங்க் யூ சார்.
அந்த டைம்ல வந்து இந்த கோவிட் இதெல்லாம் வந்ததுங்க சார். அதனால
ஆமா சார், ஆக்சுவலி அப்போ வந்து we were planning a mega rally. சென்னையில வந்து ஒரு மேரத்தான் கூட அரேஞ்ச் பண்ணலான்ற மாதிரி அப்போ பிளான் பண்ணிட்டு இருந்தோம். அதுக்குள்ள கோவிட்லாம் வந்து அதெல்லாம் கொஞ்சம் இதுவாயிடுச்சு. மேபி திஸ் இயர் ஏதாவது பண்ணலாம் சார். ராஜேஷ் சார்
பண்ணலாம் சார், நல்லா பண்ணலாம் சார்.
நல்லா பண்ணலாம் சார் இந்த தடவை. அண்ட் ஐ எம் பிளானிங் டு ரீடூ தட் ஆர்கன் டொனேஷன் பேம்ப்ளெட்டை வந்து ரீடூ பண்ணலான்ட்டு இருக்கேன் சார். இன்னும் கொஞ்சம் இம்ப்ரூவ் பண்ணி அது பண்ணலான்ட்டு இருக்கேன். ஐ வில் சென்ட் யூ அ டிராஃப்ட் சார் ஆஃப்டர் ஐ டு இட்.
ரெடி பண்ணி அனுப்புங்க.
ஓகே சார், தேங்க்யூ சார். தேங்க்யூ சுகுமார் சார். தேங்க்யூ.
மோகன் சுந்தரம் சார் சொல்லுங்க.
இல்லை நான் வந்து டீன் மெட்ராஸ் மெடிக்கல் 2009 and 10 அந்த டயத்தில் வந்து டாக்டர் TS கனகா நியூரோ சர்ஜன், ஏஷியாஸ் ஃபர்ஸ்ட் லேடி நியூரோ சர்ஜன்.
ஆமாங்க சார்.
அவங்க 139 times பிளட் டொனேட் பண்ணாங்கன்னு சொல்லிட்டு அவங்களெல்லாம் நாங்கள் பாராட்டினோம். அப்புறம் மொபைல் பிளட் பேங்க்னு சொல்லிட்டு பெரிய இது வந்து ஃபர்ஸ்ட் இதில் MMCயில் தான் ஃபர்ஸ்ட் இன்ட்ரடியூஸ் பண்ணோம். 2009 தான். ஆமாம், அப்போ தான் வந்து அவங்க டெப்டி சிஎம், அவங்க இப்போ சிஎம் டெப்டி சிஎம்மாக வந்து அப்போ கையை க்ரீன் ஃப்ளாக் காட்டி அதெல்லாம் இது பண்ணி ஸ்டார்ட் பண்ணி வச்சாங்க. அது மாதிரி நல்லா இதெல்லாம் நடந்தது. அப்புறம் அந்த 2009-10 தான் டீன் ஒன்லி ஃபஸ்ட்டு இனிஷியேட்டட் த இது கெடாவர் டிரான்ஸ்பிளான்ட் ப்ரோக்ராம். அதை இப்போ ஸ்டார்ட் பண்ணது இன்றைக்கி ரொம்ப இப்போ இது இந்தியாவிலே தமிழ்நாடு எஸ்பெஷலி GH வந்து ஃபஸ்ட்டில் இருக்கிறதுக்கு எல்லாம் ஒன்றா ரீசன் நான் சந்தோஷப்படுறேன். நன்றி, வணக்கம். தேங்க்யூ.
தேங்க்யூ சார்.
Good evening, Sukumar sir and Rajesh gave a wonderful update on the organ donation and the blood donation. So Sukumar sir ஒரு இது நல்லா இது பண்ணீங்க IMA that is initiate draft அப்படின்ட்டு. ஸோ அந்த எம்ஜிஆர் அந்த ஷூட்டிங் அப்புறம் தான் அந்த இது ரத்தத்தின் ரத்தமே அதுக்கப்புறம் நிறைய ரத்தத்தானம்லாம் நிறைய அப்டேட் ஆயிருக்கு. ஒரு சிம்பிள் ஒரு சாதாரண கொஸ்டின் சார் அஸ் மெம்பர் பாயிண்ட் ஆஃப் வியூ சார். இப்ப சென்னையில பாத்தீங்கன்னா ஒரு 35 பிரான்ச்சஸ் ஐஎம்ஏ இருக்கு. இப்ப நாங்க ஒரு பிளட் டொனேஷன் கேம்ப் பண்ணணும் அப்படின்னா கவர்மெண்ட் மெடிக்கல் காலேஜ் ஹாஸ்பிட்டல் அப்ரோச் பண்ணணுமா, இல்ல எனி பிளட் பேங்க் அப்ரோச் பண்ணி இந்த மாதிரி நாங்க ஐஎம்ஏ தான் வந்திருக்கோம், நாங்க வந்து ஒரு பிளட் டொனேஷன் பண்ணலாம்னு இருக்கோம் அப்படின்ட்டு கேட்கிறோமா? அது வாட் இஸ் த ப்ரொசீஜர் சார்?
இல்ல யார் வேணாலும் போய் கேட்கலாம் சார். அவங்க வந்து எடுத்துட்டு போயிடுவாங்க. பொதுவா வந்து நம்ம நிறைய பேர் கவர்மெண்டோட தான் இணைஞ்சுக்குவாங்க, அல்லது ஒரு சர்வீஸ் கேம்ப், அதாவது பணம் வாங்கிட்டு பண்ற பிளட் பேங்க்ஸ் இருக்குது. இப்போ லைன்ஸ் பிளட் பேங்க் இருக்கு, ஈரோட்ல லைன்ஸ் பிளட் பேங்க் இருக்கு, மெட்ராஸ் லைன்ஸ் பிளட், அவங்கள அப்ரோச் பண்ணா அவங்க எடுத்துட்டு அது சர்வீஸ் அமௌண்ட்ல ஒரு மினிமல் அமௌண்ட் வாங்கிட்டு கொடுத்துருவாங்க. ஆனா இப்போ மிச்ச பிளட் ஒரு சில பிளட் பேங்க் பிரைவேட் பிளட் பேங்க்ஸ் போனோம்னா அவங்க வந்து வாங்கணும், நம்ம எடுத்தாலுமே கூட ஒரு 2000 rupees வித்துருவாங்க, ஏன்னா அவங்களுடைய சர்வைவலுக்காக. ஸோ நீங்க எது கவர்மெண்ட் பிளட் பேங்க் அல்லது லைன்ஸ் பிளட் பேங்க் மாதிரி இருக்கிறோம் போகலாம் சார். எந்த பிளட் பேங்க் போய் கேட்டாலும் உடனே சந்தோஷமா வந்துருவாங்க சார்.
Now, sir,
Yes, madam.
we sincerely thank today we had 87 participants, sir. We sincerely thank all of them for joining us today. And we hope and request you to join for the future CMEs every month also. You can gain a vast knowledge about all these organ donation and blood donation queries. We sincerely thank our President, Dr. Sengatuvan sir, and Dr. Abdul Hassan sir for their kind felicitation. And last but not the least, we thank our Chairman Rajesh Babu sir and Advisor Dr. Suguma sir for their elaborate guidance, each and every nook and corner about the organ donation and blood donation points for all of us. So anytime we can ping them up also for any doubts and for any guidance too. Thank you, sirs, and thank you all once again for joining us today. Thank you.
Thank you, madam. Thank you, Rajesh.
Thank you, sir. Thank you, sir.
Thank you very much. Long live IMA. Thank you, Sumar sir. Thank you, Rajesh Babu sir. Thank you all.